Hello everyone, my name is Kazizarin Tasneem and the topic I'm going to talk about is dislocated shoulder. To begin with, here is a brief introduction of shoulder. The bones shoulder are made up of scapula, clavicle, and humerus. The joints involved in shoulder are glenohumeral joint, which is also known as ball and socket joint, sternoclavicular joint, where the clavicle meets the chest bone, the acromyoclavicular joint, where the clavicle meets the acromyon of the scapula, the scapula-thoracic joint, where the scapula meets with the ribs at the back of the chest. So, what is dislocated shoulder? It's basically when the ball from the socket, which is placed at the humerus, is forced fully out of its normal position on the shoulder socket, which is glenoid labrum. Name of the bones affected by the dislocated shoulder are clavicle, promaxillary humerus, and scapula. In the slide, you can see three X-ray images. The first represents normal shoulder, where the humeral head, which is also known as the ball of the socket, is in right position. The second picture is shoulder dislocation. It's an anterior image where you can see the humeral head has moved out of the position. It clearly shows that the shoulder has been dislocated. There are causes of injury. For example, traumatic shoulder dislocation occurs when there is a sudden pressure on the shoulder and it's hanging on a side or at a vulnerable position. Repetitive shoulder ligament overstrain. Individuals with such condition tend to have looser ligaments, and overstretching of shoulder joint or playing sports like tennis, swimming cause this injury. Multidirectional instability occurs when the shoulder is unstable in multiple directions due to genetic disproportion. The shoulder may feel loose or dislocated repeatedly in multiple directions. Are symptoms of the injury. Shoulder pain. As you can see in the picture, the player is holding his shoulder out of pain. Number 2 is sign of instability. Number 3, a persistent sensation of the shoulder feeling loose. Number 4, appreciation to put your shoulder in certain position. Number 5, numbness or arm weakness. Time taken for recovery is 12 to 16 weeks. One can start off most activities within 2 weeks but should avoid heavy lifting and sports involving shoulder movement for between 6 weeks and 3 months. There are physiotherapy exercises for recovery. For example, ice therapy, where ice packs are placed on the shoulder joint. Electrotherapy, a treatment that directs mild electric pulse to the problem area. Acupuncture stimulates specific points on the body by inserting thin needles into the skin. Deloading tapping technique, soft tissue massage. The next slide is basically the reference. Thank you for your time and listening to my webinar.